I'm Dr. Robert Kotler of Beverly Hills. I wanted to tell you why I invented the Reltok Clear-Flo Nasal Airway. These two soft silicone tubes fit inside the nose so that you can breathe clearly, breathe comfortably after any nasal or sinus surgery, whether it's a broken nose, correction of a deviated septum, rhinoplasty, nose job, sinus surgery. Whatever's done inside the nose will go better when you can breathe. And you know that. It's important. By the way, it's placed while you're asleep in the operating room just before you wake up. And it's removed in the office with a couple drops of anesthetic inside your nose. It's not stitched into place. And because it sits on the floor of the nose, which is never operated on, whether it's in for 1, 2, or 3 days, it doesn't hurt. The important thing is your comfort. Let me repeat, your comfort. Everybody wants to breathe. Whether you have some packing placed in the nose for a day or two, or whether or not, you will be comfortable because you can breathe. And 98% of patients who had it in place in our clinical study said this is great. And the most important thing is, a third of those patients had prior surgery where there was no Reltok Clear-Flo Nasal Airway in place. They were the most enthusiastic because they knew the difference between having it and not having it. And we want every patient to have a good experience.